Atrial fibrillation warning signs. According to the American Heart Association, AFib increases your risk of stroke by 5 times. It can also lead to heart failure if left untreated. More than 150,000 people in the US die each year due to AFib-related complications. But here's the good news. With early detection and treatment, AFib can be managed effectively. What is AFib? AFib is when your heart beats irregularly, often rapidly. Normally, your heart pumps blood in a smooth, regular rhythm. But with AFib, the electrical signals in your heart become disorganized, causing the upper chambers, the atria, to quiver instead of contracting properly. This irregularity can lead to poor blood flow, clots, and even strokes. Over 6 million Americans deal with AFib, but many don't even know they have it. What causes AFib? AFib can be caused by several factors, including high blood pressure, heart disease, obesity, and excessive alcohol use. Aging also plays a significant role, as the heart's electrical system deteriorates over time. In some cases, AFib can be triggered by stress or excessive caffeine intake. Having a family history of AFib or heart disease may increase your risk as well. Consequences of AFib. When AFib is left untreated, it can have serious consequences. One of the most dangerous is the formation of blood clots. Since the heart isn't pumping efficiently, blood can pool and clot inside the heart. These clots can travel to the brain and cause a stroke, which is why people with AFib are 5 times more likely to suffer a stroke than those without it. AFib can also weaken the heart over time, leading to heart failure. Warning sign number 1. Heart palpitations. A sudden feeling that your heart is racing or pounding is the most common symptom of AFib. You might feel like your heart is fluttering, skipping beats, or just beating too fast for no clear reason. It can last for a few seconds or several minutes. If you notice this happening frequently, it's time to pay attention. Number 2. Fatigue and weakness. Do you ever feel unusually tired, even after getting a full night's sleep? Fatigue is another common symptom of AFib. When your heart isn't pumping efficiently, your body isn't getting enough oxygen-rich blood, leaving you drained. It can feel like you're constantly out of energy, even when you're not exerting yourself. Number 3. Shortness of breath. Do you find yourself gasping for air after climbing a flight of stairs or during light physical activity? AFib can make you feel short of breath, even when you're at rest. This happens because your heart is struggling to keep up with your body's demands. Number 4. Dizziness or lightheadedness. An irregular heartbeat can cause dizziness, making you feel like you're about to pass out. This happens because your brain isn't getting enough oxygen due to poor circulation. If you feel dizzy often, especially when standing or after exertion, don't ignore it. Silent AFib. No symptoms, still dangerous. Some people have AFib without any noticeable symptoms. This is called silent AFib. You may never feel a skipped beat, but the condition still increases your risk of stroke and other heart problems. This is why regular checkups are critical, especially as you age or if you have risk factors like high blood pressure or diabetes. What to do if you notice these signs? If you experience any of these symptoms, don't wait. Talk to your doctor about a heart checkup. A simple test called an electrocardiogram, EKG, can detect AFib. Managing AFib may involve medications, lifestyle changes, or even medical procedures to restore your heart's normal rhythm. Remember, listening to your body can save your life. Don't ignore those racing heartbeats or moments of fatigue. Be proactive about your heart health. If anything feels off, get checked, because the earlier you catch AFib, the better your chances of avoiding complications like stroke or heart failure. Stay healthy, stay informed. Hit the subscribe button for more tips on taking care of your heart. See you in the next video.